Hi, this is Mark Adajar from Chicagoland Men's Health, and this video is to help guide you in how to inject your testosterone. Okay, you will receive a package from either UPS or a similar company, and in your package you will receive a vial of testosterone. Okay, and you will either receive a syringe with no needle attached and two different needles. One is going to be have the number 23, which stands for 23 gauge, and one is going to have 21, which stands for 21 gauge. You will also, or your package may contain needle or a syringe that already has a needle attached, such as this, with one needle instead of two needles, and this one should say 23 gauge. Okay, so your package may come with either a syringe with the needle attached or a syringe without the needle attached, and you'll receive two needles. Okay, so what you're going to do is you're going to take your testosterone. Now your testosterone, this one's not labeled, but your testosterone will have a label on it, and each vial that we dispense here is 200 milligrams per milliliter. You may have different formulations of different types of testosterone. However, the entire 1 milliliter will be about 200 milligrams, and the combination of the different types of testosterone will vary depending upon what we decide is the best combination for you. Okay, so how we start is we're going to start with the needle attached. If your package has the one with the needle attached, what you'll do is you will, you should always wash your hands before you do any of your injections. Always wash your hands. Okay, so you wash your hands, then you will open up your syringe with the needle attached, if your package has one needle attached, and you will take your testosterone vial. You remove the cap, you take your alcohol pad, and you wipe the top of it. Every time you withdraw from your testosterone, you should take an alcohol pad, and you wipe the top of it like this. Okay, and then you will take your syringe and insert it into the testosterone vial. Hold it upside down, and then you withdraw the amount that we have prescribed for you. I'm going to do this to 0.75 milliliters. Okay, so basically what we do is we withdraw, and you can see it's very thick. Okay, so it'll take some time. So I'm going to withdraw to 0.75. Okay, so what I do is I go a little bit I'll go to the 1. Okay, and then I will push to 0.75, which is in between the half mark and the 1 mark. Okay, now if your dose is 0.5, then it's to the half mark. If it's 1, it's to the 1 mark. If it's 0.75, it's in the middle, just like this. Okay, then I take it out. Okay, I will cap this. Okay, be careful when you cap it. Then you take your 23 gauge needle, you open it up. Okay, then I will remove the 21 gauge, the bigger needle, and you take the 23 gauge needle, which is a small needle. You uncap it. Okay, now with this, now you're ready to inject. When you inject, you can either inject into one of three places: the buttock, the thigh, or the shoulder. When you do the buttock, I feel is the best because it's a larger muscle. You won't get sore. You may get sore in the thigh, and definitely you probably get sore in the shoulder. But so I do recommend the buttock, and you would alternate sides each week. When you inject it, it's important that you inject in a 90-degree angle, and you push all the way in. Okay. Then you want to do a little bit of an aspiration, or you pull back a tiny bit on the syringe itself to make sure you're not in a vein. It's very rare, but you want to double check. So you aspirate a little bit. If there's no blood that returns back into this vial, then you go ahead and you depress it all the way. If you do get a little bit of blood, pull out maybe halfway, change your angle a little bit, and then reinsert, and then aspirate again. Okay, now when you inject into the buttock, I always, in general, recommend the area of the upper outer pocket of your jeans pocket. So you want to go a little bit on that area, and the surrounding area of a couple inches around it. You don't want to inject a little bit towards the middle too much because it's a little bit more difficult because of twisting, and there are more structures there. If you do in the thigh, you want to do in between the point in between the knee and the hip, and the meat of the muscle. Again, straight down, 90 degrees. Aspirate a little bit. If there's no blood, then go ahead and depress. All right. Once that's done, you recap it. Okay, and then you toss away, toss your needle and your syringe. Okay. Now, so that's how you do it with you inject the testosterone, and that's with the needle attached. If your needle is not, if your package is just the syringe, no needle attached, and you have two separate needles, so basically what you do, remember, wash your hands all the time before you interact with your medication. So again, I will take the one, this is the one, if your kit has the one without the syringe, you open it up, you have the kit without the needle attached to the syringe, you open it up, okay. Then you take your vial, and then you take also your alcohol pad and you wipe it again, okay. I forgot to mention, obviously before you inject into your thigh, shoulder, or your buttock, make sure you wipe the area with alcohol as well, okay? But again, so you take the syringe, it has no needle. You want to take the 21 gauge, which is the bigger needle. You will open it up, okay, like this, okay? You connect, okay? And then, again, you pull off, make sure it's screwed on a bit firmly. I already wiped the alcohol on here, okay? Then I'm going to withdraw, okay? Again, here I'm gonna do 0.75, so I go to the 1, okay, and I let it fill up, like it's filling up very slowly. Okay, good, then I'm going to push to the 0.75, right? And you can see on this syringe it says 0.5, the other one said half. Okay, so I'm at the middle. Okay, then I take the cap. I will cap this. Okay, be careful. I take this one off, and then I take the 23 gauge, the thinner needle. Okay, I'm going to open this up, and then replace it, and then this is ready to inject. And again, this can go in the buttock, 90 degrees, all the way in, a little aspiration. There's no blood, then go ahead and inject. If there is a little bit of blood, remove it halfway, redirect just a tad, and insert it again, aspirate, and then inject. Or the thigh, okay, or the shoulder, which is very difficult. I don't recommend that. You can do it, but it'll be very sore, okay? And basically, that's about it, okay? So that's how you inject your testosterone from Chicagoland Men's Health. If you have any questions, feel free to email us at info@chicagolandmenshealth.com, or you can give us a call at our main number, and we'd be happy to help you. Also, if you feel very uncomfortable despite all this, you're more than welcome to bring in your package here to the office, and I'd be happy to go through it with you personally. Okay, so good luck, and thank you for watching the video.